So our first topic here is to talk about our SOAP note, especially with the efficiency with defensive documentation. So regardless of the setting that we're each working in, our notes and everything with patient care really has to be on point. So we definitely want to be able to paint a clear picture that everything going on with our patients. So say somebody who's an outsider can know exactly what the status is of that patient. So we're going to start with your subjective. So in your subjective, especially with Medicare patients, you want to avoid the recreation talk. Anything that's golf related, sports, those aspects. They're not willing to pay for that. They care about your ADLs. So try to keep it functional. Say somebody wants a goal of prolonged walking, use your example of walking down the driveway or walking the dog, those type of things to get yourself really idealizing what's going on with that patient for that goal, but you're also showing that there's functional movement. You can ask about pain, but then try to tie it back to a function or a limitation because they might have had a higher level of pain, an 8, a 9. What weren't they able to do? Then you also want to note what's been getting better. Are they being compliant with their home exercise program? Is there any issues with their home exercise program? Most of our patients are not being compliant with home exercise programs. So you can say, even in your subjective, that patient noted not able to perform HEP at home due to blah, 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 whatever their reason is. And that also gives their justification of you later on in your note reiterating how important it is for that home exercise program. As for more of your inpatient setting, for your patients that are in bed, how much are they able to transfer themselves? Are they dressing themselves? Are they bathing? Like, what has improved since the last time you saw them? Think outside the box. Think also down long term. They're there temporarily. Do they have a caregiver at home? Do they have a significant other? Or is their goal to be completely independent if they have to live alone? You want them to still be able to do their everyday ADLs to get them to getting better.
Perfect. Hey, Elizabeth. Hope you're doing good. Okay, so I'm gonna go over the objective. So the objective is, a little bit simpler. This should take you about the least amount of time in your note. I think the biggest thing, and we can go into it more later, is figuring out what to test objectively. So like Ashley was saying, you want it to paint a clear picture, like this whole note. So you want to use your subjective. Say the patient comes in and tells you, I'm having difficulty with going up and down the stairs. So you want to be thinking, okay, what could be contributing to that? So, you want to test something like quad strength, dorsiflexion, range of motion, their ability to weight shift into that single leg stance, all of those things that could be impairments that are contributing to that functional deficit. So that's where you really want to focus. So, you're going point A to point B and painting that clear picture for your note.
Okay. Anybody have any questions so far? And say if you do, you can hold them on until the end and we can talk about it. So just let us know. All right, moving on. So now we're at the assessment part. This is kind of your most important, this is your key part of your note. This is where your professional opinion comes into play of why your patients still need your specific skills, and that's why they can't do their home exercise at home. You want to tie, as Megan said, your objective measures into your assessment. Whatever you tested that session, you want to make it into functional because of this limitation. Like I say, stairs. Okay, they can't go up and down their own flight of stairs. Why can't they do this? Because of A and B of the strength issue or a range of motion issue. You're tying the story together. You want your notes to be able to tell a story. So if somebody picked that one note out of that whole plan of care, they're able to tell exactly what you're working on, as well as why that patient still needs your care. This is also another area where you can note about your patient education. if there's anything specific, or even working as a team aspect, working with a therapist, that you were able to communicate with your therapist that, hey, I reiterated to the patient that they weren't doing their home exercise program, or something that you wanted to kind of look at together, and then having that correlation with your PT in your team aspect to be able to give that patient everything that they need for to getting their long-term goals.
Alrighty. So last part of the soap note, the plan. So I feel like a lot of people, the plan, you just kind of, you're like, all right, let's check that off the list. Cool. Like, just keep going with what we're doing. Great, done. I personally like to help myself out here, and I find that it helps me to be more efficient if I put something concrete in the plan. So, say, reassess for our example with the stairs. Say, reassess single leg stance. Something concrete that you're going to do next session. If you're team treating and you're working with a PT, even if whether it's you or the PT seeing that patient next visit, like, it's going to help jog your memory of what was going on. And then you can look at that plan and then go, oh yeah, I need to ask them about the stairs. And then that also is just going to help, say, the PT opens the note the next visit. Like, it's just really helpful to see what was going on, some concrete details, and then kind of go on from there. So that's just something that, like, I know I have appreciated, working with Ashley as a PT. That's really helpful when you're going through a bunch of notes each day. So.
And with that, it also, if you are just solely treating that patient, it also gives you an idea of where you left off, depending on what your caseload is, but it also gives you a kind of stepping stone and kind of keep bridging towards those long-term goals. So, yeah. All right. So that's your breakdown of your SOAP note. Does anybody have any questions right now?
Will there be a second session of this? You mean like the live video specifically on this topic, or like an additional video, like a part two? Or are you saying, is this like, are we going to do this specific video again? Because this does stay live. So once we go live in the group, this will stay in the group, and you have access to it for as long as you're in the group. So you can definitely, if you invite people in, or anybody that you think needs to see it, you can always tag them in the comment under the video, and they'll be able to view it. So I hope that answers your question. But yeah, let us know if you need some clarification, if that wasn't what you meant. Okay, for other students. Okay, yeah, absolutely. And invite them into the group, and then just tag them in the video, and they'll be able to see it. And if you need help, just reach out to us for sure. Anybody else? Okay. Alrighty. So now we're going to talk a little bit about tips for increasing your efficiency. So I'm going to let Ashley start with some of that.
All right, so this is some bonus content, but we're going to start with your outpatient first. So, okay, in your outpatient, you could be seeing that one client or one patient an hour to 2 to 3. So, biggest key is document as you go. You want to be able to challenge yourself to be able to finish a note before a patient leaves. So prime example, okay, depending on how you start your sessions, either with a stretch or a warm up on a bike, kind of go over, see how they're doing, check in with them. If they tell you how you're doing, how they're doing with everything, pain, whatever, go back to your EMR system, whatever you're using, and document that. It will save you a lot of time and effort. I know that you want to sit and chat with the patient, and you can do that too. Just take your computer or your system with you. Trying to get those items into your note will save you in the long run. You should be able to try to get to your notes being less than 5 minutes on a note. I know sometimes, depending on your clinic or where you're at, that you might have coworkers who want to chit chat and talk, but trying to stay up on your documentation as you treat will save you in the long run. It'll also save you a lot of headache, and your therapist who is doing your cosigns would definitely
Yes.
thank you. So trying to make sure that you document as you go. You don't necessarily have to put everything into the note, but at least getting into your subjective, your objective, and even changing your plan. Say you have more than one patient at a time, you can always save your billing and your assessment for a time that you have a little bit more free time on your hands in between patients. But really trying to document, at least getting some of that concrete stuff in there, will save you in the long run. Also, another thing is if you're interviewing for a job, ask about those things. Are you an hourly employee? Are you a salary employee? Are you have a productivity standard? Are you paid per visit? What's your supervising therapist or even your supervisor of the clinic expect of you? Those are things you can definitely ask in an interview. Those are good things to know because that gives you an idea of how to plan for your day.
Right. And then you also, if you are hourly, just know that you do get paid for your documentation time. Now, you still want to be as efficient as possible with it, and that's definitely a consideration. But just know that because I've heard of some people being told that they're not, and that's not the case. Like if you're hourly, you are paid for the work that you're doing to help the company get paid. So just know that. Is there anything else you want to
Yep,
go
we're good
over?
on that one.
Okay. All right, so we'll touch a little bit on the inpatient setting. I know for myself personally, when I was doing my inpatient rotations, it was not point of care documentation the way it is a lot of times in outpatient. So I would always, like, I would plan my route essentially and take a notebook with me. You know, obviously, you're writing down your vitals, all of your super pertinent information. And then I would immediately go to the next patient and write it down again. Go to the next patient, write it down again. All of those details that you need, you know, to write your good, subjective, and then your objective measures. And then something simple that will jog your memories. So when you go to write the assessment, it's more efficient. I feel like, you know, if you wait too long, that assessment piece gets a little more fuzzy in your brain. So you want to do that. Um, and then that's what I would do. I would just go and see a couple of patients and then go back and like I would go back to the computer and document a couple, you know, 2, 3 patients, and then go from there. So that way, that was just what helped me to be more efficient. And